At one point, we talked quite frequently here about the opioid crisis in Colorado. Then, of course, the pandemic happened and it diverted both resources and our attention. So today we check back in on the epidemic, now competing with the pandemic. Here's Anusha Roy.
It was almost expected.
We're concerned that 2020 is going to be our deadliest year again for drug overdose deaths, not only in Colorado, but also in Denver.
And it's kind of believed to be maybe due to a couple of things, due to COVID and isolation and difficulties with getting treatment.
Fentanyl is here. We were never too cute to think fentanyl wouldn't be here.
Fentanyl is a powerful synthetic opioid that the city put out another warning about a month ago. Denver's coroner said between January and August of this year, 68 people died from an overdose involving fentanyl. That's up from 25 in the same time period last year. And overall, this graph shows the Denver Health Paramedics Division responded to more overdoses from the start of the pandemic to the middle of August of 2020 compared to the same time frame last year.
With the increased anxiety, the unemployment.
We've been working hard for the last 5 or 10 years to expand treatment, and our goal right now is just try not to lose ground.
That has been tricky, especially with massive state budget cuts. Legislators did preserve a couple of key programs, including one working on access to treatment in rural Colorado, and $175 million federal dollars went to behavioral health, helping groups on the front lines keep their doors open.
In the midst of a pandemic, also an overdose crisis.
In the middle of all of this, Denver's public health department was on the receiving end of an audit. The report said it wasn't doing a good enough job of communicating and building trust with the groups running syringe access programs. In response, DDPHE said it's working on a plan to address those concerns within the parameters COVID allows, saying in part, the COVID-19 pandemic has significantly impacted the department's capacity, so we want to be thoughtful in our actions.
So one of the concerns outlined in the auditor's report was that the groups who were running the syringe access groups were saying that they didn't know how the city was going to use the data. They were worried it would get shared for policing or clearing out homeless camps. Well, the city in response said the info they're getting is anonymous. It's more of a summary so that it's not even possible for them to do that. Kyle, they said confidentiality is a critical component to the work that they're doing every day.
Anusha, glad you are back on that beat because it's so important. And to everybody who watches Next Nightly, you'll notice Anusha Smear is back. Thanks, Anusha.